And then after months of delay, the CDC is holding its first vaccine advisory meeting this week. The Advisory Committee on Immunization Practices will review and possibly make new recommendations on the flu and COVID vaccines. The CDC will also look into the measles outbreak as well. If you remember, the first meeting was abruptly postponed back in February, just days after RFK Jr. became head of the Department of Health and Human Services. The delay has raised concerns over political interference with vaccine policy. So joining me now is former director for the CDC, Dr. Robert Redfield. Doctor, thank you so much for your time this morning. Appreciate it.
Thanks for having me. Thanks for having me.
Yeah, appreciate your time. This is the first meeting under the newly appointed Health and Human Services Secretary, Robert F. Kennedy Jr., who's a known skeptic of vaccines. Do you believe new recommendations that are about to come down will be more in line with his views?
No, I think they're going to be very objective. It's the same committee that was in place prior to Kennedy being the Secretary of Health. And I think it's going to be, the same straightforward, best scientific advice to CDC on how they think they should recommend vaccine policy for the American public.
I know you've been following all the changes in D.C. As you know, the CDC suffered major layoffs and canceled funding for vaccine and cancer research. Do you have any concern over the future of the agency and the impact it's going to have on public health across the country?
I think very strongly that CDC, and I had the privilege of running it for a little over 3 years, they need to get back to the primary mission of being a public health response agency. They've drifted over the years into becoming similar to what I call an academic institution. So I think this is an opportunity for the CDC to focus on its primary mission, which is to be the premier public health response agency in the world. And I have confidence that they'll accomplish that.
One of the topics that I know is on the table both yesterday and today when some voting takes place is the current measles outbreak. And it's now killed 3 people, including 2 children. The number of infected now stands at 712 nationally, with 561 confirmed cases just in Texas alone. How do you hope the committee addresses the outbreak this week?
Well, I think they just have to reinforce what I've tried to reinforce is it's really pretty straightforward how to control and eliminate this measles epidemic in the United States, and that is to get people vaccinated. If you're a parent and your children aren't vaccinated against measles, I really encourage you to get your children vaccinated against measles. If you're an adult and you haven't been vaccinated, I encourage you to be vaccinated. If you are under-vaccinated in the late 50s, early 60s, I encourage you to get revaccinated. If we get the American public vaccinated, this measles epidemic will stop. It's pretty significant, as you know. You said we're over 700 cases now. We're in 20 different jurisdictions. It's not limited anymore to Texas and New Mexico. I also remind people, if you just go across the ocean to Europe, there's over 100,000 cases right now in Europe. So measles is back, and we have the tools to eliminate it, and that is to get the American public vaccinated. So if you're a parent, please get your child vaccinated. This is a safe vaccine, 97% efficacy. And if you're an adult and you haven't been vaccinated, please get vaccinated. Measles is the probably most contagious virus we have. If you walk into a room where 1 person has measles, if 10 people walk into that room, 9 people are walking out without measles. With measles if they haven't been vaccinated.
The numbers are just staggering, and these images that we have on repeat, just really hard to stomach and look at this morning. Sir, I got to end it there. We have breaking news to get to, but Dr. Robert Redfield, thank you so much, sir. Thanks for watching, everybody. Go to joinnn.com to find NewsNation on your television provider. Also, don't forget to click that red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.